Well, still a huge amount of speculation about if or when President Cyril Ramaphosa will formally sign the National Insurance Scheme into law. During his State of the Nation address, he said he was just looking for his pen to sign it. Huge amount of opposition from business groups and the private sector to the NHI. Paula Armstrong is director at FTI Consulting. Paula, good afternoon to you. You say our tax base, so the number of people who are paying higher levels of income tax is not big enough to fund the NHI. What are you basing that on?
Afternoon, Stephen, and afternoon to your viewers. Stephen, we've taken this from an estimate from the Department of Health published in December of 2022 of the revenue that could be redirected towards the NHI fund from medical scheme premiums. That amount of money is 200 billion rand. And what we've done is we've calculated that 200 billion rand, what the implied tax increase is across different categories of taxation. And we've come up with numbers like an increase in the VAT rate from 15% to 21.5%, or an increase in personal income tax of around 30%. And we're talking about raising 200 billion from a very, very small and shrinking tax base, who's already under a lot of pressure. It doesn't seem feasible to put into place an NHI system as a single payer, which requires this amount of revenue.
So what you're suggesting is you can actually work out how much each taxpayer would have to pay. A 30% increase in tax would be absolutely huge. I mean, just unviable, I suppose.
It would be astronomical. That would be if the entire tax revenue came from personal income tax. It's much more likely to be split across a number of tax categories, but the fact remains that the tax burden will increase, and it will increase for an increasingly shrinking group of people. Anecdotal evidence shows us anyway that taxpayers are leaving South Africa. It's unclear how we're going to raise that revenue via the tax base.
So in other words, it wouldn't be sustainable to sort of continue with the NHI as it's currently formulated?
As it's currently formulated, there are alternative options available. There are alternative options, for example, like the implementation of a low-cost benefit option for medical schemes, in which access to quality health care can be expanded to a large part of the population, which doesn't require any increase in taxation or any additional tax revenue. So there certainly is a need to address the inequality in the level of access to quality health care. Whether the NHI as a single payer is the right way to go about it is doubtful.
So, Paula, the National Health Department has responded to a lot of this criticism, and essentially they've said that the NHI bill as it currently is would really just lay the groundwork for real change later. I mean, we all know the Health Department's been very upfront about this. It will take many years, maybe a decade, to actually implement. So what they're saying is that if the President were to find his pen and actually sign this thing into law, it wouldn't change very much. And I'd like to think we can trust them on that because they're the ones who wrote the bill.
Stephen, the question is it good enough to not change very much? We have a situation where 84% of the population cannot afford to join a medical scheme. We need to change something. So it's unclear whether that's a sufficient argument. Yes, the Department of Health has been clear, and prudently they've been clear that this will be implemented over a number of decades, but that's not what's in the bill. In the bill, phase 1 of the NHI is said to be implemented between 2023 and 2026, and phase 2 is said to be implemented between 2026 and 2028. So what the Department of Health is saying is at odds with what is in the bill, and frankly, something needs to change. So signing the bill into law and saying that not much will change, to my mind, isn't enough.
So you say that what the NHI is proposing, what's in the bill, is not sustainable, except some of the numbers that you give us. But you also say, I think correctly, that the current situation is not sustainable. So we have the majority of the population who get very poor health care, if they get any at all. To go from, deep slurt to a government hospital, you have to go past 2 private hospitals who probably will give you better care. There are people literally dying because they don't get proper health care because they simply can't afford it. On the other side of it, we have people in the private healthcare sector, people who run medical aids, getting 5-6 million rand a year to run those medical aids. None of this, I mean, it's absurd, the current situation, surely.
Yes, and I think if you read the preamble to the NHI bill, 2 of the primary drivers of the need for the NHI as a single-payer system, according to the Department of Health, is to address fragmentation in risk pools and to ensure affordable access to quality health care. Now, where the NHI bill fails to address all options on the table is that it's insistent that a single-payer system is the only way to go. And that quite simply is not true. The Health Market Inquiry delivered its recommendations and its final report in 2019, and the recommendations are clear that the NHI should exist alongside a private sector system with a risk adjustment mechanism. This directly addresses risk fragmentation. It has the potential to reduce the premiums of medical schemes dramatically and make private high-quality health care accessible to a broader range of people. And this has the effect of alleviating the pressure on the public sector. And these are options which are almost immediately available. Frustration enters where there are options available. They do not require a single-payer NHI system, and they have not been thoroughly considered.
Paula Armstrong, thank you, Director at FTI Consulting. Do appreciate the time.